Good afternoon, everyone, and good morning for those of you that may be on the West Coast. Really looking forward to our conversation today. My name is Lori Zeffrin, and I'm Senior Vice President Advancing Health Equity at the Commonwealth Fund. I'm really looking forward to sharing with you a little bit of our work at the Commonwealth Fund and really mostly sharing with you about the minority health policy at Harvard University. We can go to the next slide, please. I just want to share some housekeeping, which all of you may already be familiar with. The slides and a recording of this webinar will be made available after the webinar. All lines are muted. However, you can submit questions through the webinar in the Q&A box, which is usually located at the bottom of your browser or the bottom of your screen of the Zoom screen. Excellent. Next slide, please. So our agenda today is I'll give an introduction to the Commonwealth Fund. We are very committed and excited to support this program through grant funding and partnering with Dr. Reed and Dr. Landry and their amazing team. This program has been funded for over 25 years. And just Dr. Reed will give an overview of the fellowship, and you'll hear from alumni, fellows, and current fellows about their experiences, Dr. Ibrahim, Dr. Ambrose, Dr. Fleming, and Dr. Landry. And then we'll have opportunity for Q&A. Next slide, please. So a little bit about the Commonwealth Fund. We are a foundation as well as a think tank, sometimes a do tank. We're an independent, nonpartisan, founded in 1918 as a private philanthropy with the goal of achieving a high-performing health system that provides affordable, equitable, quality care. Our work has a special focus on those most vulnerable to equity, those most marginalized, including people of color, people with low income. The annual spending each year of the Commonwealth Fund is about $30 to $40 million a year on research, policy development, and information dissemination. Next slide. We have several programs at the Commonwealth Fund. We support research in achieving universal coverage and advancing health equity, improving how care is covered, and controlling healthcare costs as well. And there's work in each of these areas and then a lot of connection across each of the programs as well. Even though you see Advancing Health Equity as a program here, we work every program within the Commonwealth Fund also thinks about and centers equity in their work. If you go to the next slide, is we think about our program in Advancing Health Equity is fairly new. The program itself has been around about almost 2 years. However, our work in equity has been long-standing. This specific Advancing Health Equity program was started to really focus on our nation's legacy of racism within the healthcare system and how can we address that, particularly its impact on worse access and quality of care and inequitable experiences and poor health outcomes. So we researched the policies and practices needed to promote, achieve, advance health equity and allow an anti-racist healthcare system where people of color can thrive. Next slide, please. We have 3 focus areas within our program, one around dismantling racism in care delivery, so across health systems or delivery systems, whether we're talking about the 4 walls of a hospital or community health centers. We also focus on using policy to bring about equitable access and equitable health care. We all know the role of policies in entrenching structural racism, and so there's a role of policies in dismantling structural racism, and there's also an opportunity to better understand the equity impacts of policies as well. And then we also have a body of work that focuses on changing culture, beliefs, and attitudes because we know the importance of narratives and beliefs in influencing policies and how influencing racism and bias, explicit or implicit. So really this change in culture is a key aspect of our work as well. We go to the next slide. advancing diverse leadership in healthcare is a core part of our work. And that's where this Commonwealth Fund Fellowship in Minority Health Policy at Harvard comes in. Our goal and our theory of change, we use theory of change in philanthropy, is to, by helping to promote and increase diversity in senior leadership positions and health policy and systems, and leaders that are not only committed to health equity, but also well-versed in how to promote equity and how systems of structural racism can appear. That will, help improve healthcare delivery for historically marginalized people, shape the discourse and design of health policy, increase the dedication of health systems and improving health equity with focus on justice, which will foster health system change and create healthier, more equitable communities. You'll hear more from the alumni and the current fellows on the amazing work that they're doing. There's just an illustrious role of alumni and current fellows across this fellowship that are really changing healthcare as we know it to really integrate health equity throughout. Next slide, please. I just also want to talk about a little bit of our work in health equity at the Commonwealth Fund. I told you that we support, promote, fund research to drive policy change and systems change. Feel free to go to our website to learn more about our program and our work more broadly at the Commonwealth Fund. This is just some of the work that we've published recently, whether we're focusing in on learning from other countries in terms of how to advance health equity and what are best practices or what other countries are doing, to differences in Medicaid and Medicare and commercial health care insurance and how that impacts equity, to really addressing federal laws and the impact of emergency care on recent policy changes, such as the Dobbs case, for example, which significantly shifted the reproductive landscape by making abortion no longer accessible. If we go to the next slide, please. So I just wanted to give an example of some work that we've recently done about how discrimination in healthcare affects older Americans and what health systems and providers do. We actually had our international survey, if you go to the next slide, where we wanted to get a better sense of how older adults in the United States view health and healthcare and view how the healthcare system treats them compared to other high-income countries. And not surprisingly, we see that older adults in the US are most likely to report their health system treats people differently because of their race or ethnicity. And in this work, if we go to the next slide, we also see that in the US, nearly half of older Black women say the healthcare system often treats people differently because of their race or ethnicity. And if you go to the next slide, 1 in 4 Black and Hispanic older adults report racial or ethnic discrimination when seeking health care. And with this work, we put this work in front of healthcare system leaders, in front of policymakers, in front of the media, to really help think about, provide visibility into the issues that we're seeing, to provide comparison with other countries, and really help drive policy change in a meaningful way. If you go to the next slide, we also saw that more than a quarter of US older adults who experienced discrimination based on their race and ethnicity felt that they did not get the care that they needed as a result. Really, the linking of discrimination and outcomes is really something that we've seen in a range of data and is also repeated in this data source as well. And through this work, there's some policy recommendations that we communicated, if we go to the next slide, which focus on how do we promote transparency and accountability by identifying instances of discrimination. How can we publicly report discrimination data? Is there an opportunity to promote medical school and develop medical school curricula to educate students about the role of bias and how that harms people? How can we examine current policies and how they enable discrimination and then reform those policies? Or how do we address the lack of diversity in US healthcare, provide culturally appropriate and contextual care? One other body of work that we also recently did, we actually talked to, if you go to the next slide, a number of older Black and Latinx adults. And, we also heard from them that, what they felt was important in a primary care relationship. So for example, one participant said, my doctor greets me and and respects me, which is something that we want to have in a healthcare relationship. And then also, if you don't trust your doctor, you don't feel comfortable enough to say what you need. Again, reinforcing the importance of trust. And then also, perceptions and what they've experienced about, not being believed because of just the thought that Black people can tolerate more pain, which has been borne out in other studies. So I just wanted to show you some examples of some of our work at the Commonwealth Fund. This fellowship is near and dear to our work. And we're so happy to continue to support it. Just wanted to introduce you to the Advancing Health Equity team. Marenike and Noel are key to the program, so please feel free to reach out if you have any questions. If you go to the next slide, I just wanted to move us to, and feel free to reach out to me on email or Twitter or LinkedIn. Happy to answer any questions you may have about our work. If you go to the next slide, please, I'd love to transition this part of the program to Dr. Joan Reed. For today's speakers, Dr. Reed is the Dean for Diversity, Inclusion, and Community Partnership, Professor of Medicine, and the Program Director of the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University, and also Dr. Ibrahim, Dr. Ambrose, Dr. Fleming, and Dr. Landry. Dr. Reed, thank you.
Thank you. Thank you very much, Dr. Zephyrin. It is my pleasure, we can go to the next slide, to tell you about our Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. And we have 3 goals for our program. The first is to prepare physicians, particularly physicians from groups that have been underrepresented in medicine, to become leaders who will improve the health of historically marginalized populations through transforming systems, promoting innovation in policies, practices, and programs, all moving us towards health equity and addressing social determinants of health. The second is about increasing representation of individuals, physicians from groups that have been marginalized, underrepresented, and moving them into places where they will be leaders in government and philanthropy, the public, the private sector, the academic sectors, and across full systems. And the third is around continued career development. And you'll be hearing from one of our alums today to talk about this continued connection as individuals leave the fellowship and move forward in their careers. Next slide, please. The fellowship was started in 1996, and amazing outcomes, and that's because there are amazing fellows in the program. As you can see, 100% of them have remained engaged in research or the academy and policy and service delivery that impacts the health of minority and disadvantaged and vulnerable populations. The majority of them have academic appointments in medical schools or schools of public health or dental schools. They publish. They serve on committees, they serve on task forces, they've received honors and awards, and they cover multiple disciplines, not just one. Here you see internal medicine, peds, family medicine, surgery, psychiatry, emergency medicine, cardiology, really across the full spectrum. Next slide, please. In terms of eligibility for the programs, the Commonwealth Fund Fellowship is for physicians who have completed residency and are therefore either board eligible or board certified. And they need to be US citizens or permanent residents. And what we're looking for is evidence of leadership experience or potential, and a commitment to historically marginalized populations. It includes the tuition for a degree at the Kennedy School of Government or Harvard T.H. Chan School of Public Health, an MPH or MPA, health insurance, books, travel, program expenses, but also a $60,000 stipend. But I'd say one of the most important benefits is also a network of fellows and individuals who are equally committed to creating change. Next slide. Some of the aspects of the program, as I said, there's a degree from the T.H. Chan School of Public Health and MPH, or from the Kennedy School of Government and MPA. From the T.H. Chan, the MPH can be in either of 2 fields of study, health management, or health policy, but there's cross-registration in classes across all of Harvard's faculty. So if you want to think of the B School, the Ed School, the Kennedy School. And I'm happy to say that in this year, the 22-23, it is in person. We had some changes in the past 2 years where it was all virtual and then hybrid. It is in person now and will be in person into the future. There are key course requirements. Many of them relate to the degree requirements for an MPH or an MPA, but also courses such as Leadership and Minority Health Policy, courses that are specifically tailored to the goals of the fellowship program. Next slide, please. Some of the activities of the fellowship: there are leadership forums and opportunities to meet key leaders in this space around health equity, social justice, dealing with issues of disparity that you'll meet as a fellow. There are special sessions around developing leadership skills. There's seminar series, journal club, sessions on op-ed writing and how to improve communication skills. This practicum project, mentoring provided on multiple levels from alumni fellows, from faculty across the Harvard system, and from individuals who are in leadership positions from across the country. There are both individual and group meetings among the fellows. Most fellows attend national conferences such as Academy Health or APHA. There's sessions around nuts and bolts where hospital leaders provide insight into their sort of work that they're doing in hospital systems to create change, and then meeting with the fellows to discuss this. Site visits that occur at both the national level and locally, shadowing of leaders, and an annual meeting where current fellows and alumni fellows come together. Next slide. When I think about this array of activities, it's this opportunity in the fellowship year to build your own personal narrative, your story, understanding your journey to the fellowship and where you want to go next, making it very personal. Expanding your networks of individuals who can both help you and you can help and will carry you forward as you move through your career journey. It will foster this understanding of systems and interconnections and the ways in which you can create change, and connect you to leaders in government, leaders in philanthropy, leaders in the academy, from multiple sectors again, and strong alumni connections, strong lasting alumni connections. Next slide. So for an overview of the timeline, application deadline is December 1st, 2022, and 2 applications are required. For all applicants must apply to the Commonwealth Fund Fellowship, but for those who want the MPH, they also have to apply to the Harvard T.H. Chan School of Public Health. And for those who are going for the MPA, they have to also apply for the Kennedy School of Government. So 2 applications have got to be completed. Next slide. And some of the alumni, and they are in multiple places. Individuals such as Joe Betancourt, who's Senior Vice President of Equity and Community Health, founded the Disparity Solutions Center at Massachusetts General Hospital. Alice Chen, who's Chief Medical Officer for Covered California and a Professor of Medicine at UCSF. Michaela Cook, who spent some time at NIH, but is now the Executive Director of PCORI, the Patient-Centered Outcomes Research Institute. It's Wando Oldwalla, who is Senior Vice President and Chief Health Equity Officer for Humana, so public and private sector, and is a member of the National Academy of Medicine. Wal Noor, who is the Chair of the Department of Obstetrics and Gynecology at Brigham and Women's Hospital. Ross Jones, who is Medical Director for Community Health and Medical Director for Total Care Group in Jacksonville, Florida. Don Warren, who is on his way to Johns Hopkins, where he will be co-director of the Center for Indigenous Health and a professor in the Bloomberg School of Public Health. And Dora Hughes, who's now Chief Medical Officer for CMS, Center for Medicare and Medicaid Innovation. Next slide. So fellows have gone in many directions, and here you see a slide of our 6 current fellows. You have here 5 Commonwealth Fellows and 1 Joseph Henry Oral Health Policy Fellow. But you see from multiple disciplines: internal medicine, pediatrics, cardiology, child and adolescent psychiatry, family medicine. They've come from multiple parts of the country, from Virginia, from South Carolina, from Georgia, from Boston. Very different career trajectories, but all deeply interested in creating change in systems and making them more just and more equitable. Next slide. What I'd now like to turn to is this opportunity to actually hear from our fellows. And Nazreen Ibrahim is one of our current fellows, and I'd like to turn it over to her at this time. Nazreen.
Thank you, Dr. Reed, and welcome everyone. Next slide, Jackie. So I wanted to start a little bit about and tell you a little bit about my journey to the Commonwealth Fund Fellowship. I went to medical school in Cincinnati. I did my residency there, and I did my first fellowship there in cardiology. After that, I went to the University of Colorado, and that's where I did a fellowship in advanced heart failure and transplant. And because I wasn't done training, I came to Boston to the Massachusetts General Hospital, and I did another fellowship in research, and I stayed on as faculty there for 3.5 years. After that, I was recruited to the Inova Heart and Vascular Institute. It's part of the Inova healthcare system in Northern Virginia. They like to say that they're in DC, but they're not in DC. And over there, I was director of clinical research, and I was the associate program director of the cardiology fellowship. But throughout my time, especially as an attending, I had seen the disparities within cardiology, but specifically within heart failure and within transplant. And next slide, Jackie. And this is what, next slide again. And this is what became the driving force for me applying to this fellowship and wanting to gather the tools, mentorship, and network to really make a difference on a much larger scale. So I'm not going to talk a lot about data, but when I show people the data, it makes a little more sense why I want to do the work, and I'm passionate about the work that I'm doing. So on the left is the heart failure and mortality in young Black women and men, and these are individuals below the age of 45. And that top line there is the mortality in Black women and men, and you can see it's much, much higher than every other race and ethnicity in the US. And the right graph is data we published about rates of transplant over the last several years. And as you can see, despite Black people having much higher mortality from heart failure, they're not getting transplanted at the same rate. So the stories from the patients that I had seen, the data that myself and others have published, became the driving force with me wanting to look for opportunities that will train me to be able to make a bigger impact and change the outcome here. Next slide. So I had searched for a lot of fellowships. I had heard about the Commonwealth Fund Fellowship at my time at Mass General, and I really wasn't sure about the timing of applying because I was now 5 years out of training, but I knew I needed to pause and figure out a way to get to where I wanted to with my career, and how I was going to be able to make a change, and how I was going to change this from a policy level, even from an institutional and systems level, to change the outcome in Black women and men with heart failure. And so I met with Dr. Landry. We were both on a White House roundtable series. I sent him an email and I spoke to him. He encouraged me to apply, and it's been amazing so far. This is a picture of my classmates. We've been here for a little over 3 months, and it's just been fantastic. And the network that Dr. Reed talks about, we already have access to it. We've met with phenomenal leaders in this space. We're all my classmates, we all have the same mission, which is to make healthcare better for historically excluded patient populations. We all are in our own lanes, but we all have the same mission. So it's just been so far truly fantastic to be in this fellowship, and no regrets about leaving attending life and just taking this year to really hone in on the skills that I need to change the world the way I want to. Thank you, Jackie.
Thank you, Nazreen. Our first alumni speaker is Jacques Ambrose, Commonwealth Fund Class of 2020, and a Senior Medical Director at Columbia University Irving Medical Center. Jacques?
Thank you so much, Dean Reed. Aloha, everyone. Thank you for the opportunity to join the conversation and to have a discussion about health equity. It always feels good to come home. And I think that's probably is the best adjective that I have to describe what it feels like to be a part of the fellowship. I think you've heard a lot of folks talked about the community and the network. And I think out of all of the benefits of the program, I would say that's probably one of the most powerful benefits of the fellowship is to be a part of this movement where people are so dedicated and so passionate about the work that it doesn't necessarily feel like work at all. So I'll start with a little bit of a narrative about my own stories. I'm originally from Hawaii. I'm a first generation immigrant and the first generation college student. And growing up, I was growing up very, very, very poor. And I think one of the reasons for me to do the fellowship after I finished residency and fellowship and more fellowship was to better understand my own story and the equity work that I wanted to do and contribute to the world. And I think, as Dean Reed mentioned earlier, I think it's really important for the fellows not just going through the academic process of taking classes and learning in this environment, but also to better understand their own story and their own narrative as it relates to the equity work that they want to pursue. And I think for me, originally, a lot of the drive and the ambition for me was how do I continue to escape the world of poverty that I came from? And really throughout the course of the conversations with my colleagues, with mentors and advisors during the fellowship, that it really began shifting more towards, instead of running away from something, what can I choose to run towards something and what can I do to cultivate the work that is building on just, I mean, decades and decades and decades of passion and commitment from fellows, alumni, current and future. And I think for me, the three most important selling points, I think as a previous prospective person to consider, it's truly is a continuous learning environment when you're in the fellowship. It is quite rare to find a space in which everyone understands intuitively and naturally what you're hoping to accomplish and what you're hoping to gain from the experience. And then second, it's just the growth mentality that the fellowship has an amazing, amazing ability to truly inculcate into us that this is not just a one-year fellowship. It's meant to be a beginning of a lifelong chapter that we get to write. And then lastly, I think, as I mentioned earlier, the community and the network that we now belong to is invaluable. I think it is so heartening to hear from former fellows talking about their own work and then sharing their own work on the email listserv. And you're just thinking, wow, I'm now part of this really magnanimous group that's doing amazing, world-changing things. And it's truly is a source of inspiration for me every day. And I think one of the things that I would recommend for future prospective fellows is to just examine for yourself, what is it that you feel this drive, this burning ambition of what you want to create in this equity space? What is that seed? And how can this fellowship really be the fertile ground that you can grow and cultivate that whatever it is that you wanted to work on, that project into fruition? Thank you so much, Jackie.
Thank you, Jacques. Our next alumni speaker is Mary Fleming, Commonwealth Fund Fellow, class of 2011, a locum tenens physician, obstetrics and gynecology, but the president of the Reed Scholars, Inc. Mary?
Thank you so much, Dr. Reed. I'm so excited to be here and share our fellowship with you and hopefully answer any questions that you may have afterwards. So I appreciate all the participants for joining us. And of course, thank you so much to Dr. Reed for her leadership with this course, and for Lori Zephyr and the rest of the Commonwealth Fund who continue to support us. And so you will hear, I think you have heard, as echoing over and over and over again that this is a family affair, that it's not just a 1 year and done situation, that we really feel connected both to our cohort of fellows, but also to the fellowship itself and the rest of the alumni network. And I'm just sharing a few photos from the year, and that how well we worked and played together. So you spend a lot of time with your co-fellows, you learn them very well. But it is so reaffirming to be in a space with like-minded individuals that you can both professionally and personally grow with throughout the year. And so in addition to the meetings that we went to as part of the program, like going to Atlanta and meeting Martin Luther King III, we also traveled together to New York to sporting events. People came over and we had chili cook-offs at the house. And so we really enjoyed spending time with each other, and we continue to stay in touch afterwards. So just again, underscoring that this is more than just a learning environment. This is really about professional growth and development with like-minded people who will continue to support you as you move forward through your career. You can go to the next slide. So much so that I'm one of those people, and you'll hear from Alden in just a second, that kind of came to the fellowship and never left. So I started to be immediately active in Reed Scholars, which is our alumni nonprofit that all members and graduates of both the Commonwealth Fund Fellowship and the John L. Henry Oral Health Fellowship are members of after you graduate. We wanted to continue to be able to network together, to have a venue for supporting each other professionally and personally, again, through our development. And we do that a few different ways. So we have an annual health equity symposium that happens in May in conjunction with the minority health meeting that is hosted in Boston. We'll be planning our 6th annual leadership retreat. And we wanted to do that to give, again, more time for us to interact with each other, to conduct the business of the organization for Reed Scholars, but also to provide another opportunity for professional development throughout the year. We, of course, have our regular business and board meetings throughout the year. And in 2020, we kicked off the Reed Scholars Live, which is a health equity podcast, and really helping to try to build upon the health equity voices within the fellowship, but also beyond, and having more conversations that we don't have time to do in our day-to-day lives. So it's been a really great opportunity for me as the host to speak to other health equity leaders across the country. I actually just did a health equity podcast with 2 nuns, one of which is a urogynecologist and does a lot of maternal health and birth injury repair in Uganda. So we are now also global. And so I'm really excited about the opportunities that venue will grow for us. And we want to stay connected. So we do virtual our social hours with the current fellows throughout the year to give them as much exposure to the alumni as possible. But when we can go in person. So I had the opportunity to spend a little time with the current fellows last week in Boston. And so I really, really enjoyed that. So just, again, underscoring that this is a fellowship that gives you wonderful didactic training that you don't even know how much it's going to affect and grow your professional career, and the opportunities that will be available to you because you've done the fellowship and because you have the continued network with the other alumni and leaders that you will meet along the way. But also we know that as we go back out into our everyday spaces, sometimes they can be lonely and there's not a lot of support there. And so the Reed Scholars also gives us that social support, that network that you can lean on as you're trying to figure out next steps in your career and personally, as we all try to balance this so-called thing called life and figure out where we're going next. So with that, of course, you can always reach out to me along with the others if you have any questions about the fellowship, about my personal experience, about Reed Scholars. If you want to be a guest on the podcast, you can tell me that too. So with that, I will pass it back to Dr. Reed.
Thank you, Mary. And for our final alumni speaker today, it's Dr. Alden Landry, class of 2010, Assistant Dean in the Office of Diversity, Inclusion, and Community Partnership at Harvard Medical School, Assistant Professor of Emergency Medicine at Beth Israel Deaconess Medical Center, and Associate Director for the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. Alden.
Thank you, Dr. Reed, for the introduction, and thank you all for having me here. My apologies if I have some Wi-Fi difficulties. I was actually working clinically today in the emergency department prior to joining this meeting. I think there's not much that hasn't already been said about how amazing this fellowship is, and I can attest to this both as a learner and a participant of the fellowship program, and then also as someone who is now on the leadership side of the fellowship. This is truly a transformative experience, and I often joke when I'm giving advice about the fellowship for individuals who are interested in applying as to what the fellowship offers and how it can be truly career changing. And the comment that I typically tell people is what you gain over a 10 or 15 year career in public health as a physician is really condensed down into 1 year in this fellowship. And it really changes your perspective on how you go about the practice of medicine and how you think about engaging not only patients, but communities in how we advance healthcare. Really thinking about this from a policy perspective. It's a truly transformative experience. One of the other things that I like to point out about the fellowship is the community that the previous speakers, this is truly a network of amazing dynamic individuals who have ascended to great heights in their leadership roles, whether it be within their local health organizations or hospitals, their academic medical centers, their public health departments, either on the state, local, or federal. It's just an amazing cohort to be a part of, that these individuals that you are now going to be a part of that network also understand where you are coming from and the background that you have experienced healthcare as a learner and as a trainee and as a physician in practice, and how you can help to make those changes for those individuals who are most vulnerable and at need. I will stop here because I know we want to make sure we address the questions that are starting to come in through the Q&A. And I know Dr. Reed just dropped a note in the chat to encourage everyone to use the Q&A for questions or comments. But before we turn to the questions and comments, I do want to make sure that we highlight a quick video that really emphasizes some of the work that was done by our Commonwealth Fund Fellows during the COVID pandemic. One of the things you'll get to hear from this video is how quickly individuals were ready to respond, not because of, most importantly because of the training that we had in putting us in a position to assume leadership roles and to care for our most vulnerable communities. And so with that, I'll ask Jackie and Ying to cue up the video so we can watch that.
When the pandemic hit, the Commonwealth Fund Fellowship had already been training leaders in minority health policy for more than 2 decades. By then, more than 140 fellowship alumni, 100%, had been actively engaged in aspects of policy, research, and/or service delivery related to minority health and/or public health. And a significant number have assumed leadership roles in federal agencies, state, county, city departments, and/or in national and regional organizations and associations. No one could predict that the pandemic would strike when it did, but we knew that a crisis like this would worsen disparities in our healthcare system, and the Commonwealth Fund Fellows were ready to respond. this is what we have prepared for.
What I remember from that time really is just the profound uncertainty. I remember not knowing what direction we were headed in, looking at Italy, looking at New York, wondering what was coming our way.
Having a public health lens and having an understanding of how to protect the public is very important in the delivery of care, because it allows everyone to think about all of the paths and the levers we need to pull, the paths we need to take and the levers we need to pull in order to maintain a sense of order and elevate health for everyone.
So the fellowship had a way of training me to think bigger and higher than what the issues might be happening at that moment. And so for an example, as Chief Diversity and Inclusion Officer, I was thinking through COVID and how it impacted our patients, but also how is it impacting our underrepresented in medicine faculty and trainees and students.
From the very beginning, there was a disproportionate burden of cases, hospitalizations, and death amongst Black and Indigenous people of color, and the disparity seemed to widen as time went on. The fellowship certainly provided me with a network automatically of experts as it pertains to how to address disparities in care and outcomes amongst underrepresented or minority populations. It also demonstrated to me, or helped me to better understand how we can meaningfully partner with people, whether it be folks in our community, whether it be organizational leaders from grassroots to corporate, or whether it be our civic and government officials to enact change.
And if it wasn't for the fellowship, I don't know that we would have made progress in some of the public health actions we were able to take, building epidemiological data, making sense of what was going on and helping people who are in dire need. The fellowship, is an incredible community of people that even to this day continue to do things to address the pandemic and think about how do we, recover, rebuild, have resiliency, and reimagine the future so that we're not in this position again.
I want people to stop talking about health equity just with like-minded peers in an academic space and really start to have this conversation amongst their friends, in the beauty shop or at the barbershop or at the PTA meeting and that type of thing, because that's really how we affect change. We have to talk about it with people who don't look like us. We have to talk about it outside of the healthcare space.
We're really at an inflection point. This is a window of opportunity for change. So then how do you harness that opportunity? How do you use this as a chance to finally address structural racism, achieve health equity in a sustainable way? And I would say, what could possibly be more important right now?
Even though we're trying to address the issues related to COVID-19 and the pandemic, the other healthcare inequities that were present before the pandemic are existing through the pandemic and will last beyond the pandemic. So I think that our fellows are uniquely positioned because we've been thinking about health equity and health policy for years, and now we can apply our lessons learned through the lens of a pandemic, focusing in on addressing those health inequities that other leaders may not be thinking about because they may have other areas that they're trying to focus in on. And I think there are opportunities for the fellows to step in and to lead in the spaces where leadership is lacked. And I think that's one of the fundamental strengths of the fellowship is people are given the tools for success.
Thank you. Amazing individuals and amazing work that has been done during the pandemic before it and continues to be done now. I'm going to turn to the Q&A, and some of you have started to submit them, and I thank you for that. If there are other questions, please submit or comments. I'm going to take two of them straight off, and one is their age eligibility. We are about advancing diversity, so no, there is no age eligibility for the fellowship. If you are board certified or board eligible and you have that degree, that MD, or you have that dental degree, you are eligible to apply for the fellowship. It's meeting those criteria, US citizen, permanent resident. And so, and if we look at our fellows, there's individuals who've entered the fellowship in their late 20s. There's individuals who've entered the fellowship in their 30s, 40s, and even 50s. And then there's another one about if you already have a public health degree, and I had mentioned that you could apply for a degree for MPA at the Kennedy School. That is only eligible for individuals who already have an MPH. So if you already have an MPH, you'd still like to participate in the Commonwealth Fund Fellowship, you would then apply for the MPA at the Kennedy School. If you do not have an MPH, the option for you would be the MPH at the T.H. Chan School of Public Health. And we have individuals that have done both, that have done the Kennedy School program for the MPA or the T.H. Chan for the School of Public Health. There's a question here about, is a strong research background required to apply for the fellowship? And I'm going to ask one, I'm not going to pick on the person to answer this, but could one of you take that as a question to respond?
Yeah. I'm happy to try and answer that question. You know, one of the ways that we like to think about this is, are you a producer of data or a consumer of data? And I would argue that many of the individuals who have gone through the fellowship are better at the consumption of data and using that data to advance health equity as opposed to producing the data. We do have some alums of the fellowship who have large backgrounds in research and even continue to do some research. But really the emphasis is on taking your skill set, your passion, your interest, really honing in on how we can help you to become a better leader, and to think about public health and health policy as a way to advance health equity. And oftentimes that can be done while learning how to use data as opposed to creating the data.
Thank you. As I think about the fellowship that's been around for more than 20 years, part of what brought some of the fellows to research was the areas of interest. The data were not there, and they needed to do the research in order to understand where they wanted to head with the policy. So they were driven by this desire to create change in policy, but needed the research, needed the data, needed the evidence to help guide them. Anyone else in terms of this research question?
I'd just like to say that I appreciate what Dr. Landry said about, we produce this data, and that's why I came to the fellowship to say we already have the data. What can we do, or how can we implement programs to change the outcome? Because the data is already there, in my opinion, in the space that I'm interested in.
Thank you. There's a question here: are fellows selected immediately after they've completed residency or fellowship training? Or do you find that prospective fellows who've had some time as attendings or in other spaces are better suited for the fellowship? And Nazreen, I'm going to ask you, because you spoke a little bit to this, to answer this, but for you also, Mary, because you have the full breadth of the alumni fellows of their journey to the fellowship. So Nazreen?
Sorry, was this just about clinical experience?
Well, this is coming straight from residency, or having other experience before you come.
I think it was, for me, I think it was valuable to have the attending experience, because it helped with my personal growth. It helped obtain leadership skills, but I also had the opportunity to see exactly what I wanted to focus on and where I wanted to make the change, and to see how patients were directly affected by the policies that are in place, and resulting in worse outcome for heart failure patients, poor access to transplant for Black, Latinx, low-income patients. So I think that's where my passion came from, is having that clinical time, seeing the real life stories of the patients, having time to publish some of the data. But now I'm in a space where, what am I going to do with all the data and all the clinical experience that I've had? So I think it's been valuable to have that clinical experience before the fellowship.
Thank you. And Mary, this breadth of alumni that you work with.
Well, I think for me personally, I came straight out of residency. And honestly, I think every time is the right time. It just depends on what it means for you. I think from the fellows I've heard, coming straight from residency, understanding that we want to do something different and bigger than clinical medicine and trying to figure out how to get to that next step is helpful. I think there are those, to Nazarine's point, who've been out for a little bit, learned more, understood a little bit more from their clinical experience and want to pivot a little bit. It's helpful. And then, of course, we've had fellows who've come in 20 years into their career who have, a strong foundation in clinical space, but are trying to make a transition into leadership or an admin role, and they needed something to help transition. And so I think in those cohorts where you have that diversity, it's just more learning from each other. I remember there's an old story about Brian Swan not knowing how to use PowerPoint right when he got there, because he was a little older than most. And so there's lots of ways that we can learn from each other, not just from our clinical and health equity roles, but also just learning about new technology. So I think it adds to the breadth of the diversity within the cohort. And to Dr. Reed's point, come all. But every time is the right time. If it makes sense for wherever you are in your journey, I say apply and we'll figure it out together.
Thank you. And as you mentioned Brian Swan, one of the questions here is, are there opportunities for dentists in the program? So that's a perfect timing. Dr. Swan, Brian Swan is a dentist. And so the Joseph Henry Fellowship, and it's for an oral health. So there is a sort of comparable program to the Commonwealth Fund program. It's for dentists, and it's the Joe Henry program. And we can get you more information on that. I would say, and then the fellows are here, once they are here and together, a large part of what happens is the dentists are explaining to the doctors about what are the issues in oral health and vice versa. And there's this shared learning. It's not that people are treated differently. It's really about how do we come together and educate and inform and support one another. So not one discipline is not one more important than another discipline, as we looked at the fellows. There a few people have asked questions about moonlighting. And Jacques, I'm going to ask you if you want to speak to that.
Thank you so much, Dean Reed. First, let me just add that one of my co-fellows is a dentist, and my teeth have never been so clean and floss so regularly until after the fellowship. So I am eternally grateful for her. To answer the question about the moonlighting, I think it is a balancing question, because I think it's a personal question in terms of the stipend is there, it is whatever it is, and then whether or not your personal situation can afford that. And I think for me, who's taking care of not only myself but my family back home, I think it is legitimately a challenge. And at the same time, I think the other lens is that you are taking this dedicated, circumscribed time to really focus and invest in yourself in health equity work, and making sure that you are also making that investment for yourself by not getting too distracted by anything outside of the fellowship, because it is truly, truly a full-time experience. And I wouldn't trade any of that for anything. And I think in addition to some of the moonlighting work, some of the questions have talked about maintaining your clinical skills. And I think that's reasonable. And at the same time, you've been in medicine for like 8-10 years now. You will not forget how to practice medicine. And I think ultimately a lot of what we ended up doing really is trying to make sure that we can get the best out of the full fellowship. And I would put that in the forefront as much as possible, because you're already taking a year off from your professional life. Don't change yourself in the experience.
But to reinforce that, I think there's been very little time in most of our professional career development where somebody has said, I want you to spend the time focusing on you, creating your narrative, understanding yourself and where you want to go. It's almost a luxury. And so how do you take full advantage of that time? There are questions here about this, how you could, what you could do to enhance your application. And I'd be interested to know what fellows think they could do to enhance their application. But for all of the fellows have been involved in the process, getting into the fellowship or speaking with alumni or with prospective fellows. Suggestions for what people should think about in their applying.
I'll go ahead and start. So one of the things that I think is really important, the experiences that many of us have had along the way for applying to medical school, residency, etc., is the ability to share a story in the form of the essays that you were asked to write. And it's really important for you to take some time and really think thoughtfully about how you want to answer these questions, because it does help us to think about your next steps in your career. And so when you look at those multiple essay questions that you are asked to write as a part of your application, it's really helpful for you to open up and tell us about that time that you failed or you struggled, or to talk about one of the experiences that you may have had along the way that has really helped to shape your thought process as to why advancing health equity is so important. And so I would say really dedicate some time to those essays to help us get to know you best. And then secondly, those letters of recommendation are really important. Choose individuals who can speak to your strengths, to your knowledge, to your passion around advancing health equity, and make sure that they have an understanding of the fellowship prior to your application so that they can help for us as evaluators of your application to see how your interests align with the expectations and the experiences that come from this fellowship program.
Anybody else with some tips, some pearls?
If I can add to that, I still remember my interview with Joan, and we were just talking about like what really drives you, what gets you pissed off about the inequities in the world. And I think if I have a recommendation to prospective fellows, I would say find whatever that flame is that really drives you. Whatever that thing that keeps you up in the middle of the night, because that's what's going to keep you going beyond the fellowship, and really thinking of the fellowship as a space to refine, hone, and develop the necessary skill for you to take the world by storm. And for better or for worse, I think, as you can see, all of the fellows and alumni have come in all shapes and sizes. It's just being you, just being really, really authentic and genuine with who you are as a person, because that's what they want to know. That's what everyone is just dying to know about you. And your stories are so incredibly unique that no one else can tell that story. So being able to genuinely craft that narrative in a way that speaks to who you are as a person is, I think, one of the most compelling things you can do.
Right. I would say, and I'm looking at the time, and this is about being your authentic self. This is not the time to say, let me paint a picture of what I think they want. This is a time for you to say, no, this for us to understand who you are, where you've been, and where you want to go. And this relates to some of the other questions that are in the chat, such as other opportunities to learn about policies that impact immigrant health or reproductive health for aged others. All of that's possible. If you look at fellows, they've done all of that. This is a time for you to pursue your area of interest, your area of passion. It's not predefined. It's all on the table. And that's why you're being very straightforward and honest and true to who you are can help us to help you better across the board. In terms of there's questions about here about how to people with families manage. There's questions here. All of these are things that please write us. We will get back to you on all these. These are not new questions. People have had their families stay home. People have brought their families with them. People have started whole new families during the fellowship. It's all happened. It's all part of this real world space. They're just real people living and trying to move forward. I want to say thank you all for joining us today. Lori, thank you to you and your whole team and to your staff, to our fellows, our current fellows and our alumni fellows. Thank you so very much for sharing your insights and your perspectives today. Thank you for joining us for this session, and apply, ask us questions, get more information. You can see the fellowship contact information, our phone number, our email, visit us. You can look at the website and find more about the fellows and who they are and where they are. They are all open. They all want to help. Again, thank you.